di integrazione.
New medicines, and we will hear from Dr. André Dourado about bringing different medicines together. Go ahead. A homeopathic doctor and director to EMAC, which is Escola, talking about mental health and the importance of approaches promoting health by integrating traditional medicines.
Mato, for invite us to be here today to speak about this so important theme that we are speaking since yesterday. I want to speak about mental health. I work with mental health and also with cancer, mainly in Portugal. And I want to give you my insights about the actual situation. So, the World Health Organization states that the promotion of health or mental health and the prevention and treatment of mental disorders are fundamental to safeguarding and enhancing the quality of life, well-being and productivity of workers, families and communities, thus increasing the strength and resilience of society as a whole. Every year, mental health problems affect at least 25% of the European population, at least. Mental health problems, including depression and anxiety, are the main cause of disability and early retirement in many countries, and a major burden to economies demanding policy actions. And that's not all, because we are not taking into account the impact of these mental problems on physical health, such as cardiovascular disease, as you can see in this slide, but also in other diseases like gastrointestinal diseases. As we see here today and yesterday, nutrition is very important to cardiovascular diseases, but it's not all. We need to focus also in physical activity, good sleep, and levels of stress, because we must see the human like a whole, like an holistic point of view. And of course, about cancer. I work a lot with cancer, and I have a different perspective of cancer than I had 10 years ago when I started working. Well, actually 11 years ago I started working with cancer. I already saw thousands of women with breast cancer. In the beginning, I thought that the main causes of cancer were nutrition and environmental toxins. Today, I have a different perspective, and I see stress has a primary cause, and if it's not the primary cause, is a secondary cause. Nutrition, of course, is very important. Toxins are very important, but we are emotional beings. And women are very affected by emotions, like we are men, of course, as well. So I found this article that exposed this situation and related some kind of types of stress, because stress is not all the same, with breast cancer. And it makes all sense for me because I see women with cancer every week. I can check if this is true or not. Mental health ends up affecting social peace and democratic institutions as well. There are several factors that can lead citizens to mental disorders that we can do so much about it, such as continuing to improve the conditions and environment in which citizens work and live, fight against sedentary lifestyle, and bad nutrition, or be more proactive, protecting people from misuse of modern technologies, as we know so little about the impact of social networks apps, for example, in human mental health. Practicing mind-body exercise like mindfulness, meditation, yoga, Tai Chi, or Qigong has been shown to decrease depression, anxiety, and increase resilience in different groups and genders, from maltreated children to health professional workers. Incorporating approach such as mind-body exercise can increase health promotion and cardiac rehabilitation service that can improve self-efficacy and long-term adherence to health behaviors, as well as improve personal stress management skills. This was stated in the Journal of Cardiovascular Nursing. Many people with depression and anxiety turn to non-pharmacological and non-conventional interventions such as yoga, meditation, and exercise. And meta-analysis and systematic reviews have shown that these interventions can improve symptoms of depression and anxiety with no negative effects. In the hierarchy of evidence, these type of studies are at the top, so they are the best studies we can have. But other complementary therapies has been shown to be helpful in management mental health, such as Reiki or craniosacral therapy, for example. There are much more. I just only have time to show two. They are also non-pharmacological therapies and can reduce anxiety levels. The COVID-19 pandemic has become an unprecedented threat to humanity worldwide. During the pandemic, various challenges for mental health arise, such as temporary social isolation, fear, and economical risks. Mind-body modalities can reduce the long-term adverse health effects associated with COVID-specific chronic stress. This systematic review aims to investigate the role of non-pharmacological therapies in managing the mental health of healthcare workers during the pandemic. A comprehensive search was conducted using 6 electronic databases, resulting in 18 clinical studies from 2019 to September of 2021. Meta-analysis showed that mind-body exercises significantly improve the perceived stress of health professionals. In other study, an evidence map was created based on 126 studies that provide a broad overview of available evidence of traditional, complementary, and integrative therapies in times of COVID. While evidence maps can provide a broad overview of the research, the findings have had more positive than negative effects to help guide evidence-based decisions. Like we can see here, at green and turquoise are the good results. This is of great importance when recent studies indicate that use of antidepressants in Europe continues to increase, as we can see in this graph. I'm not saying that antidepressants are not useful. They are very useful in acute situations, but people taking it for 10 and 20 years, I think there is not solution. A large number of studies have been published showing that the efficacy of non-pharmacological and unconventional interventions, they do not replace conventional medicine, but are adjunctive therapies that can decrease long-term use of prescription drugs, as well as the healthcare burden, as highlighted in some studies. As a naturopathic doctor, cooperating with psychologists and physicians, I confirm these statements. And mental health is not just about being happy or sad. Mental health is key to promote also democracy, human rights, and environment. Thank you very much for your time.